From sports injuries to arthritis, all kinds of musculoskeletal problems are now treated with laser therapy. Professional athletes like the Toronto Raptors and Maple Leafs use low-intensity laser therapy to help them get back into the game. And now, armchair athletes can too. We visited the Meditech Laser Rehab Clinic to check it out.
We utilize a low-intensity laser, which in essence is a healing laser. We've been treating patients for approximately 10 years.
Hi, Ken.
How you doing?
Good.
I have an appointment with Dr. Cox.
Great. He'll be with you in just a minute.
Great, thanks.
Thank you.
I was an ex-hockey player, professional hockey player, and it's just one of the old injuries coming back on me, and gradually gotten worse to the point where I have very little feeling in my arm.
If you want to just remove your shirt from me, and I'll get you light up. Thank you.
Ken has fairly severe traumatic arthritis of the spine. He has only had, I believe, 5 treatments and has had about 70% of relief of his symptoms. No longer requires medication. So he demonstrated quite a rapid response, and I think he'll continue to do extremely well. Laser light stimulates the cells, in essence, to repair themselves. How much improvement have you made since the last treatment?
First 2, I really noticed a very big difference, and then after the 3rd, I had a bit of a regression.
So we'll make a minor protocol adjustment change today.
I'm having pain treated in my back from a fracture that I had, and it's left me with pain in my mid-back, particularly on one side, and I have a lot of scar tissue, and hoping that the laser will break some of that up.
She has quite severe degenerative osteoarthritis of the spine, which was also aggravated by an additional injury skiing. So she has a fair amount of pain and discomfort. Other than surgery and anti-inflammatory, there's really very limited therapy available. So this is where laser is so applicable.
Just go ahead and put those on for me, please.
Currently the cost is $30 for a half an hour of treatment.
With my last treatments that I've had, as soon as I get up and go off the table, I do feel relief right away.
Okay, Nancy, we're all finished.
Okay.
Thank you very much.
The patient generally requires anywhere from 1 to 30 treatments, depending on the condition. Acute conditions generally respond much more quickly and are often resolved in 2 to 5 treatments, whereas chronic conditions take considerably longer.
Good
to see you. Robert, who came approximately 8 months ago, utilized 2 very stout canes, moved extremely slowly, and never unaided, and was basically immobile.
The pain was so severe that I could not stand up, and I could not even take a shower. I'd have to sit on a plastic chair in order to bathe. It really was unbelievably terrible. At a social gathering, I met Dr. Kahn. One thing led to another, and I ended up here getting the treatment. Now, I can stand in the shower, and I even worked on a step ladder and put a drop ceiling in the laundry room of our house, and there was absolutely no way whatsoever I could have ever done that. And my goodness gracious, that's probably the best dinner I've ever gone to.
Now Dr. Fred Kahn joins us to tell us more. Welcome. Laser is being used for almost everything now, from laser eye therapy to wrinkles to sports injuries. And when it comes to sports injuries, we've had mixed reviews in the past about laser. So tell us how the technology has changed and what we're now looking at.
Basically, the engineering of the devices today has become much better. The device has become more sophisticated electronically, and we've really been the leaders in that. There are about 6 different parameters that we can adjust to control the photon stream of particles that are used to irradiate the tissues and, in essence, heal the tissues. So it's become extremely sophisticated from an engineering point of view, and also the application has become more dramatically evolved.
Now, in terms of the applications for this, we're looking at all types of musculoskeletal injuries. Is it good for fractures? What can you use this for and not use it for?
You can use it for virtually any musculoskeletal problem, and all tissue consists of cells, so all cells respond. Bone tissue, of course, being more dense, responds less to the nerve tissue, which is quite sensitive to laser. But all tissue does respond to varying degrees.
Now, we have all types of other modalities that we see the physiotherapists use, for example, things like TENS that now are being brought into home systems. Are we likely to see lasers that are used professionally being brought into home models that we'll be able to use on our own?
We're working on a number of prototypes with regard to that, and the one thing that laser therapy distinguishes itself from the other modalities such as TENS, ultrasound, infrared term, it's curative. It heals the cells at the biomolecular level.
Well, that's all great news. Thank you so much for sharing this new technology with us. Dr. Kahn is going to be back later in the show for Ask an Expert. Up next on Balance, unique training techniques with Rod Black. We're back with Dr. Fred Kahn to answer your questions. First one for you, Dr. Kahn. Eunice from Fredericton, New Brunswick. I am 67 years old and have experienced leg cramps, especially when I wake up. I eat a lot of dairy products and take calcium. Could this be a circulation problem?
Potentially, yes, but it doesn't sound like. A lot of people have cramps in the morning, various times through the day, maybe related to degenerative osteoarthritis of the lumbosacral spine, so probably an x-ray of the spine. Otherwise, nothing to be concerned about.
Okay. Next question. Lori from Seashell, British Columbia asks us, my daughter has shin splints. How serious are they, and will she suffer for life?
She will not suffer for life. They're not terribly serious. Occasionally we get a little long-distance runner or sprint runners who have them quite severely, can be readily treated by laser. Generally, people with activity level changes, shoe changes, relieves them as well. But laser is obviously the best therapy.
And what is a shin splint? So many people use the phrase without really knowing what it is.
It's people after activity, the anterior tibialis muscle, which lies between the fibula and the tibia, the large bone of the body, compressed by the fascia, the envelope that overlies the muscle, and when you get lactic acid buildup, you get some swelling in the muscle, so you get a feeling of tightness, pain, etc. And once that's relieved, it's
a lot better.
Okay.
Michelle from Bowmanville, Ontario. I'm only 23 years old, but I often experience knee pain when coming in from outdoors. What could this be, and what should I do?
In a person that age group, possibly osteomalacia patella, which is erosion of the posterior aspect of the patella. Again, it's nothing serious to worry about. Could be a mild degree of synovitis by activity.
See your doctor?
See your doctor.
Good point. Thank you so much
and
for
an
your
X-ray.
advice. All right.